Good afternoon, everybody, and thank you all for joining the May Telehealth Learning Collaborative hosted by the North Country Telehealth Partnership. My name is Nancy Del Mastro, Telehealth Project Manager at AHI. I work alongside my colleagues at Fort Drum Regional Planning Organization, and we welcome you all to our May meeting. As usual, we will be starting with our state agency telehealth updates. We will not be hearing from OMH today. I wanted to note that Amy Smith, who was our longtime contact at OMH, has left her position, but there is a telehealth inbox now for OMH that you can direct any questions to, or of course, you could send any my way. And I'm hopeful that for our next meeting, we will have a new representative from OMH joining us to keep us apprised of all of the updates on the telehealth front from there. That being said, now I will turn it over to Kendra and Megan at DOH to give us some updates on telehealth at the Department of Health. Thank you.
Hi, it's Kendra. I'm sorry, my mute button didn't want to unmute. I'm sorry about that. Can you hear me?
Not a problem, Kendra. Yes, I could hear you now. Thank you.
Hi. Okay. Megan, do you want me to go first or do you want to go first?
Kendra, that'd be great if you could start.
Sure. Okay. So just for an update, our telehealth regulations are still out for public comment for a little bit longer. The only feedback that we've received thus far is positive, so we're pleased about that. We also are working hard on telehealth policy and just finalizing what that post-pandemic policy will look like, and we're waiting, as everyone else is probably, to see how the federal public health emergency, if it's going to be extended. We would expect to hear something by tomorrow because they did say that they would give the states 60 days notice. So to the best of my knowledge, we have not heard that the public health emergency is going to end mid-July yet, but that information, there still is time. They do tend to wait to the last minute. So we're still waiting to hear about that. And then also we've had two recent hearings, public hearings on our 1115. It was previously known as the Sherpa extension of the waiver, which we're excited. There's, we have requested $300 million over 5 years for investments in telehealth. Not sure if we'll, if that will come to fruition, but the state did put in the request for that. So there have been some public hearings. If you've missed those, if you look on the website, and then also I could put it in the chat if you'd like. There's a link to the waiver amendment document, and then also how to make public comments on the waiver. And I think that's pretty much all I have. We're still working on alignment with other agencies on telehealth parity.
Great, and this is Megan Procorum from the Office of Primary Care and Health Systems Management in the Department of Health. As Kendra mentioned, we are working alignment on payment parity across agencies, and the new state budget included language on the insurance law side for commercial insurers that are regulated by the Department of Financial Services. There is payment parity language in the new budget bill, and we are waiting to see implementation guidance on that. In addition to the 1115 waiver, we did have some small grants available for telehealth equipment for healthcare providers. We hope to be able to announce awards soon. And also in the new budget, there is going to be capital funding available for health information technology and telehealth equipment. And I do want to make note that they are capital dollars, so these need to be equipment of with a useful life of 3 or more years. We don't expect to be able to issue that funding opportunity until next year, so I will absolutely keep everyone up to date on the status of all of those initiatives. And that's it. Thank you.
Thank you so much, Kendra and Megan. As I mentioned, we do not have OMH on the line today, so I will turn it over to Kelly Grace at OSS to give us any telehealth updates she can provide.
Guys, this is Kelly. I think the last time I was on this call, I let you all know that we did adopt our telehealth regulations. So they are final and published, and we have released finalized guidance. And so our regs pretty much made permanent all of those COVID flexibilities that we allowed throughout the pandemic. So that's kind of the only real update we have on our end.
Thank you, Kelly. And I did see a bulletin come out on prescription of controlled substances after the federal PHE regarding the Ryan Height Act. So I will share that document in the meeting notes for everyone's review in case you did not see that guidance come out on the 10th. And I did have put in some information regarding the telehealth parity within the budget, and I'll share that, of course, in the notes as well. Tony isn't available from CMS, but we do have Thomas Bain on the line. I just have to make him a panelist quickly, and when I do, Thomas, you'll be able to unmute and share on behalf of CMS.
Okay, can you hear me?
Yes.
Oh, perfect. Thank you. And thank you for the opportunity to fill in for Tony today. As was mentioned earlier by New York, a lot of people are watching the space around the public health emergency and the 60-day notice. So I know some people were wondering about yesterday, since it was the 15th and the current PHE goes through July 15th. I also don't have any further information about that, but it should become known to all of us very soon. And then Tony just asked me to remind you of, on the telehealth Medicare side, a new modifier that went into effect in April. So this was announced in January, so you may have already been aware of it, but there's a new FQ modifier for telehealth mental health services for a service that is furnished using real-time audio-only communication technology. So just wanted to remind you all of that, but otherwise, all of the other waivers and flexibilities that you have been tracking around telehealth remain in place as linked to the public health emergency, which currently runs through July 15th. So I'll put the link to more information about the FQ modifier in the chat. And that's all of our updates for this month. Thanks so much.
Thank you so much, Thomas. I appreciate you joining us today. And with that, I don't see any questions or chats coming in through regarding any of the updates, but of course, I will be typing all of this up and sharing it with the meeting notes and the recording for your review after the call. So feel free to send any questions you may have regarding the updates that were shared my way, and I'd be happy to assist you. Now I will be turning it over to our presentation, which will be given by Heidi Ziemer and Olivia Helfer, both from the Western New York Library Resources Council, to give a presentation on their Telehealth in Libraries pilot. I'm going to make you, Olivia, the presenter right now, and you should be able to share your screen from there.
Thanks, Nancy. Here we go. Okay, we'll get this started. Thanks again, Nancy. It's a privilege to be invited to come here, and right off the bat, Heidi and I are very relaxed about presenting. So if there are any questions at any point in time, feel free to pop it in the chat, pop it in the Q&A. We'll be happy to address highly relevant things in the middle of the presentation, or we'll definitely circle back at the end if there are higher level questions that anyone might have. So on that, Heidi, I'll hand it over to you if you want to introduce yourself real quick.
Sure. Thanks, Olivia. I hope you can all hear me pretty well. I don't have my video on because I'm working from home today and I don't have the greatest broadband connection, so better to have it off. But as Olivia said, we are very pleased and honored that you've asked us to speak about our pilot project in telehealth in Western New York Public Libraries. My name is Heidi Ziemer. I am the Outreach and Digital Inclusion Coordinator at the Western New York Library Resources Council. And I guess we'll probably get right into this. Yep, there we go, first slide. So before I even address what the information that's in the slide, I just wanted to give you a little bit more context of how we got to the telehealth pilot. In many years, in the time before pandemic, it sounds like a fairy tale, but before the pandemic, several years before it actually, Olivia and Grace, our health hospital library services coordinators, co-coordinators, had organized programs that were being presented live in person by Lydia Collins, who at that time was with the National Network of Libraries of Medicine. And she was doing workshops on consumer health information. So it was directed not just at health librarians or hospital librarians, but also at, school or public or academic librarians who had an interest. And one of the things, and I attended these workshops, and I was amazed at the number of health information resources that were out there that the NNLM has curated and created, and the different languages and the different topics and the different ways you could access the information. Never knew anything about this, and I was really surprised that we didn't have as many other types of librarians other than health or hospital librarians attending these. And I think a lot of people like me might have just assumed, well, this is really a specialized kind of thing, and it's really for those types of librarians and not somebody like me in a public school or academic library. So one of the things that Olivia and I talked about was ways to encourage more types of librarians to become more aware of health information resources. And so Olivia and I came up with a grant that we proposed to NNLM in their All of Us grant program, where we designed a health information literacy program that was open to any member librarian in the Winnie Lurk region, the Western New York region. So we did in fact have academic, public, and school librarians enroll in the program. And what it did is that they would take so many hours online from NNLM to obtain their CHIS, Consumer Health Information Specialist. I hope I said that right, Olivia. I always got it wrong.
You got it
wrong. Their CHIS certificate, CHIS level 1 or level 2. I'm sure you're probably all aware of what this is. It was all new to me again. But the grant paid for them to get those certificates, to earn the hours, get the certificates. And then in addition, once they completed level 1, we gave them a sum of money through the grant for their library to offer some health information literacy programming. And so while we were visiting, and this is where we get into the weeds with the telehealth. So while we were visiting the different sites that had participated in this program and had gotten the grants, we started to notice through the stories that people told us about themselves, their patrons in these libraries, in the rural libraries, in the urban libraries, the difficulty that people had in accessing health services, especially in the rural areas we were hearing stories about. For example, someone who was on a heart monitor, and because and the signals are sent, I guess the tracking for this would be sent to the health provider in like at Buffalo General or whatever, but that their signal was, I guess the health provider called the person and said, why aren't you wearing this monitor? And they said, well, he is wearing it, but the broadband, the signal is so bad out here that it keeps dropping. So it was, things like that. The travel distances for people, the trepidation of people with language barriers or other barriers in urban areas that had in coming to health services. So our grant was wrapping up around the time the pandemic had started. And then IMLS came out with their COVID CARES grants. And that's when Olivia and I decided to write a grant to pilot telehealth in 2 public libraries in Western New York, one rural and one urban. And in doing the research, we discovered something we already were pretty much aware of, but we didn't realize the extent of the health disparities in the Western New York region. Particularly in low-income areas in both rural and urban areas of the region. And so we wrote this grant. We did not get the grant, but the evidence and the data that we provided seemed significant enough that the WinnieLurk board approved the spending of money to actually test the 2 pilots without this grant. So WinnieLurk paid for the test pilots. One of the things that, that became very evident is that digital inequities, lack of broadband, lack of devices, lack of the skills to use digital resources was definitely becoming or had been a social determinant of health, but at this point it was more clearly being recognized as something like that. So this pilot was our attempt to address the health disparities through enhancing the digital access that people could have for health services, particularly, if they couldn't have in-person visits for whatever reason, whatever the barriers were, including, the reasons that I mentioned for the earlier grants. So digital inequity as a social determinant of health was one of the main emphasis of this particular grant. And because libraries are seen as trusted sources of information and support, and because we already recognize that a lot of libraries are doing a lot of digital skills training or lending devices or lending Wi-Fi hotspots, or turning on their Wi-Fi 24/7, that they would be ideal locations for people to be able to obtain telehealth services. And the bottom line is anyone can use public library. There is no barrier to using a public library. So Olivia, you're gonna move on. Yep.
Thanks for the background, Heidi. Hopefully now everyone has an idea of kind of where we were coming from. And the images that you see on your screen now are the 2 telehealth pods, as we call them. One library did call it a wellness pod. And this is the one on the left of your screen is at the Leroy R. Coles Jr. Branch Library, which is the urban library that agreed to participate in the pilot. And then on the right-hand side of the screen is the James Prendergast Library Association, which is the rural library that agreed to participate. And so we use the money that our organization was generous enough to grant us and purchase these pods from a company called SpaceWorks. I will say that, Heidi and I did some research beforehand and reached out to other people who are piloting similar projects in their communities. There's one in Texas that we talked to. It was someone in Delaware that we talked to. Those were the 2 main people. And we'll have their contact information on a later slide in case you want to reach out and learn more about their programs as well. But we got some information from them about what worked and what didn't work and things to look out for. And so we decided on these SpaceWorks pods and made sure that they were ADA compliant. You'll see a little black ramp down there at the bottom. And we invested in some window coverings because there's a lot of glass. So privacy is obviously something that we were very aware of and wanted to be cognizant of in terms of people being willing to use the space. So we purchased these window coverings where you can't see into the pod, but you can see out of the pod. And inside there's some lights and air ventilation, and you could purchase furniture to put in there. But again, we wanted to make sure that everything inside was mobile in some way, so that anyone who had a wheelchair or a walker needed a little bit of extra mobility space could use that comfortably. So everything within the pod itself can be removed, or there are tables that are mounted on the walls that can be folded down so that the space can be used in its entirety. So we also purchased some laptops and headsets and a mouse and mounted monitors on the wall for each of these spaces, so that the users could be comfortable using either their own device if they brought their own device, or the library would provide the device for them if they didn't have that with them. Particularly with our pilot, we really wanted to make sure that there was a person that was a contact point for anyone who wanted to use the space. And so we did go through a process of training people through both in health literacy resources and in digital literacy skills. Very informal training, but it was material that we pulled together from North Star, Project of Literacy Minnesota. And then we used resources from NNLM to curate a really brief overview of this health literacy and digital literacy skills that this individual would need in order to be able to troubleshoot any technical issues and answer any health information questions that someone might have as they were using the space. And we wanted to collect metrics surrounding the use of the space, not only from the public side of view, wanting to get information about, where they were coming from. Were they coming from the immediate area? Were they coming from far out? Were they driving a long way to get to this space? What was their reason for using it? How did they hear about it? Did they have questions and follow-up information that they wanted after they'd used the space? Was there something we could do to improve it? And we also wanted to get an idea from library staff on their take of how successful it was. And so I will say, as with any pilot project, there are problems everywhere. So we'll get into some of the issues that we encountered, general areas of concern. And Heidi, I'll start off, and then please, we'll kind of bounce back and forth, because I feel like there's so many things that we ran into and opportunities that we were able to address different concerns in both of our library populations that just came up. I think probably the biggest one that we were concerned with was community buy-in, and really wanting to make sure that the community saw the benefit of using a space like this, and that organizations, mental health facilities, primary care facilities, hospitals, that those organizations saw the value of having an additional space where their patients or their clients could come to access telehealth services in a secure and stable and private environment. And so that was our first area of concern, because we didn't just want to start this and not have anyone be interested. And staffing was another one. Heidi, did you want to talk about staffing?
Well, staffing is part of, under the Coles branch, you'll see the partnership with the community college. That was who was going to do the work of, promoting these booths, of making the appointments, of assisting people and helping them with the technology, and maybe even following up with, directing them to health information resources if they had questions. We wanted to be as hands-on off as possible, because we realized that, one telehealth pilot was at one library system, Chautauqua Cattaraugus. The other one was Buffalo and Erie County Public Library System. And so they have different ways to administer their branches. So we didn't want to interfere with that. And we also didn't want to, place an undue burden on the library staff, recognizing that, everybody is kind of overwhelmed with jobs to do. So the staffing, we suggested creating partnerships with local colleges to have students, like grad students in social work or in health services work, to assist with the project. And actually, the Prendergast Library in Jamestown, New York, the rural one, they did partner with SUNY Fredonia's social work program, and they did have a student there for the entire this entire past semester. So she was there to assist, and she spent, what was it, Olivia, like 16 hours a week, I think?
Yeah. And not only doing stuff for this project, but also other projects at the library, which was a great help. Just because she had this very complete view of what it was to work in a library and provide services to the community members there that were exactly what they needed.
And actually, I think the person who the director was directly supervising her, but another librarian was actually kind of managing, I guess, what she was doing. And as a result of the project, the librarian that was managing her ended up getting a
promotion, essentially.
A promotion. So she's now the assistant manager because she handled and managed this whole new project so well. She ended up getting promoted, and she was very interested. She became very interested in this idea of, health services in public libraries. So she's a big advocate. So it had that kind of side benefit that we weren't really anticipating. Marketing and promoting. What's that?
Yeah, I said it was really encouraging to see. It's kind of one of those things that you don't want there to be a problem, but if there is a problem, you want the best outcome. And so that was such a good outcome from something that we had not foreseen in terms of just staffing and trying to figure out that issue of being able to man that space.
Right.
So yeah, sorry, Heidi, marketing, go for it.
Well, I was just going to say, and related to the marketing, so that person did undertake the marketing, and the Buffalo branch actually had a problem in getting started because they had thought they were going to have a new floor installed that was going to shut the branch down for a couple months, and then that kept getting delayed. So they were late to hire, but they also did have a student from the local community college come in and assist. But in both cases, the marketing and promoting, again, I think one of the issues was, do we directly promote to individual patrons? Do we promote and market to the health providers? The Buffalo branch did try to hold an open house where community-based organizations that provided any kind of health services, including mental health services, were invited, and nobody showed up.
We had a council member come, because again, we also tried to promote this to legislators as well. And we got a lot of positive feedback from legislators, and maybe one or two of them would show up at some of the things that we did, which was encouraging. But I felt like that was a big, thing that we encountered, was people would say, oh, this is such a good idea, we really like this. And then we didn't necessarily get the usage that we were expecting from that. So it was a lot of trial and error. I know we sent out a lot of emails. We invited a lot of people to different things and tried to share information with them. And at both of the branch libraries, I know they made flyers and did word of mouth, and there were press releases and social media blasts and all sorts of things like that. And so, yeah, I was kind of just throwing everything at the wall and seeing what stuck. And I think we're still in the process of trying to figure out what works best, and who is the golden ticket, like who's the best person or group or organization to promote to. and get that again, because that's closely related to buy-in as well. And maybe part of that is longevity, just having it stick around to the point that it becomes expected. And then people are familiar and comfortable with it. So that's definitely been something that we're still trying to figure out, but it's been an interesting ride.
Yeah, and there were other hiccups like the change in the branch manager, that there hasn't been like a big chunk of time where this could be consistently applied, I guess, is part of what was happening. But I do think that one of the things that had been mentioned when we talked with the social work student who worked in the Jamestown Prendergast Library, she said that she was aware of successful telehealth partnerships where there was a single health provider. So our arrangement was this was not instituted by a health provider, and it was not managed by a health provider service. This was something the library did itself. And for that reason, there was no, we weren't hooked to, there were no real privacy issues, so to speak, because the portal, once somebody had logged in and then logged off, the computer is supposed to be wiped so that, no information would remain. That was part of the job responsibility of the person managing the booth. But we weren't tied to a single provider, so we didn't have to deal with a lot of those issues. But I do think that was part of the reason that we didn't get the success with the usage, just because I really still think that telehealth is driven by the health providers at this point. It's not an initiative that the public takes up on its own, I don't think. One of the things that we had suggested to the libraries is to just run a program, like a public program, like you do, your genealogy programs or your, how to make something program. Just do a general program and use the booth to show people how to do a telehealth visit. I don't know that any of them ever did that. But I do think that that's the kind of thing that might have to be done to encourage more people to explore this as an option who might not have thought of it before. I don't know. And the privacy thing, again, location of these booths or the spaces, if you don't have a booth and you have a space, really matters, because the one at the Coles branch was downstairs in the basement level where it was away from the main traffic, so a little more private. Plus it was against a wall, which I think really helped with the sound damping. The Prendergast was upstairs on the main floor in the main corridor, and so even if you had privacy inside the booth, you still had to get to the booth, and it was pretty open. The big glass windows behind it, as you saw from the images, I think were all contributing factors to people not having a sense of privacy and using that particular booth. Even though you can't see in, when you're sitting in there, you can see out. And if you were sitting in that booth and looking out, you'd be looking at the whole big open foyer. You'd feel like people were looking at you, even though they couldn't see you because of the effect of the coverings on the glass. But so I think position where the space goes is a really important factor when putting these telehealth spaces into a library.
Yeah, and I will say that was the other thing there. The ceiling height was so different between the two spaces. You'll see, like at the Coles branch, it's in a relatively normal size ceiling height. But at the Prendergast Library, it was like two floors, and the ceiling is totally open, and you have these beautiful glass windows. But it did the sound, you could just hear everything. And that was a hiccup that we had in terms of trying to resolve the sound dampening issue, because you don't want someone who's reading a book to be hearing your telehealth appointment at the same time. That's not ideal. So we tried, Spaceworks was wonderful. They sent us sound dampening boards that could be mounted onto the walls, and they did that free of charge. And so we tried that first. That didn't work. We tried I think they got a white noise machine that didn't really help that much. They ended up redoing the seal on the door, and that ended up being the thing that helped most. But again, because it was a quiet part of the library, you had a really high chance of there being echoes and just any small noise you would be able to hear. So that was something that put a delay on certain things, but also you really wanted to make sure that people did feel that their conversations were private and not being overheard by the entire library. So location really matters when it comes to these pods. And even I feel like to a degree, even though you think it'd be a good idea to put it in a really, really quiet place, sometimes having that background noise, that white noise of people just milling about or having their own little conversations, I think that might actually be a good thing because they're not paying attention to what's going on in the pod. They're kind of paying attention to their own little things. So that was something that was a good thing to learn, and we'll definitely take that forward in future endeavors. Which brings us to this side, moving forward. We already kind of talked about the partnerships that we can have with human services or health services and social work students at our local community colleges or universities in the area. That seems to have been a really good partnership that we're forming and are still working to solidify. And then we've also seen a lot of interest in other public libraries in the area, mostly north of the city, Buffalo, so in Niagara Falls, and then out in Medina and Lockport. All of them are looking to get their own private telehealth pods to put into their libraries, some through grant funding, some through partnerships with other organizations. So that's been really encouraging to see, and we've been able to share a lot of what we've learned and things that we say, please don't do this.
And we actually also built some of our experience off of some of these, and in turn they have built theirs on what we've been doing. The one example is the Hoig Library in Albion. So Olivia and I, when we were developing the pilot, we did a lot of exploring to see what else had been done, where else it had been done. And one of the places that we found out about was that the veterans organization had given money to pilot this very similar but much fancier and bigger booths that had been developed by the Phillips Company in partnership with the VA. And one of the test sites just happened to be in Gowanda, New York, which is south of the city and like the border of Erie and Cattaraugus counties. So we talked with the people at the VA who were responsible for that. And as they learned about what we were doing with the public libraries, they said, well, we'd like to get more. The pilot we have is in Gowanda, but we'd like to do something up north because we have a lot of veterans up north who have this need, they and their families. So we put them in touch with the Hoig Library because we knew that they had expressed interest in this project. And now they are partnering and going forward with their own a partnership between the VA and the Hoig Library, I believe, to put telehealth booth in the public library up there.
And I believe we put our VA contact in communication with someone in the Rochester region, which was another area that the VA had a deficit of communication with the veterans that they were serving. And so I'm not sure what the status of that is, but I know that was another opportunity that came up, that hopefully there's another partnership that can be formed to serve the veterans in different parts of the Western New York area. We also just saw this increased awareness of digital and health literacy, not only in the library populations, but in the general public as well, which brought us to the North Star subscriptions, which we'll talk about on the next slide. And then the collaboration opportunities that came out of this, which Heidi mentioned, the VA partnership and being able to collaborate with them. And we're in the baby stages of just talking with different levels of departments of health at our county level, and then hopefully at the state level, to discuss if there's something that we can do as just libraries in general to partner with them and be another place that they can tell the public to, oh yeah, go to your library and do this. And tap into the wealth of knowledge and the resources that are available in your own backyard, in your own community. So we've seen some really good collaboration opportunities come out of this as well, which is really encouraging. And so these are other projects of interest that at the very beginning, we mentioned that we had gotten ideas from 2 other programs. The first being the Diane Connery, who's down in Texas at Pottsboro Library. She has started the telehealth community of practice. She partnered with the health system down in her very rural community. And that was in the middle of the pandemic, and they got a pretty good turnout of providers that were telling their patients to just go to the library to have their telehealth appointment because these people didn't necessarily have internet or they didn't know how to use the devices. And so the library was there to help them get the health services that they needed during the pandemic. And then also in Delaware, Nick Martin spearheaded the Get Connected program, and they also partner with a single healthcare provider. And he started the National Telehealth Working Group, which has been meeting, I think, for 2 months now. And if you're interested in hearing more about national telehealth projects that are going, well, I should say telehealth projects, but across the whole entire country. Yeah. So different regions, how they're managing it, how they're getting funding, what problems they're encountering. It's been a really informative group thus far. And I know that they're meeting again in the first Tuesday of June, I want to say. So if you're interested in that, let Heidi and I know. We can pass along more information about that group. I'm sure Nick would be thrilled to have more people join because it's really interesting to hear about other people's projects. And then the Healthy Libraries program. Did you want to talk more about this one, Heidi? Because you, I think, know more about this than I do.
Right. Well, actually, I found out about this program. This is in Long Island at Stony Brook. I am actually part of the National Digital Inclusion Alliance, digital inclusion, digital equity platform across the country. And trying to connect with different people in New York State, I was able to connect with Rajiv Lajmi, who he is at Stony Brook, and he is now the head of their technology, something I can't remember what it is. It's like a lot of cybersecurity thing, but he's also part of that NDIA. He introduced me to Lisa Ben Scott when I told him about this pilot, because she is at Stony Brook in their health services program, and they have recently created a partnership with public library systems in Long Island to have their health sciences students in the public libraries. And they do programming as well as do referrals for people for different times of the week. And they have a calendar, and they put the programming up in the public library calendar. So we've been in touch and exchanging information about our programs. And in fact, she is the one who has organized, and I think Nancy's going to be on that meeting, where we are going to meet with somebody from the New York State Department of Counties Department of Health, coming up toward the end of this month. So again, it's a great network, a great opportunity for all of us to collaborate, communicate. And there's the Atlas, that's the VA telehealth program that I was talking about in the previous slide. They've actually expanded their pilot from, I think the original was 7. Now I think they've got about 14. So they've added some across the country. And Olivia mentioned the North Star digital literacy assessments. I don't know if you want to talk about that, Olivia.
Yeah, just to share a little bit really briefly, and I believe we sent Nancy the slide deck. So if you would like any of these links and whatnot, please let her know, let us know. I'd be happy to pass along the slide deck so you can get more information about this. So North Star digital literacy assessments was something that Heidi actually came across as we were trying to develop our digital literacy curricula, I guess, or just training documents for the individuals who would be staffing our telehealth pods. And North Star has free assessments. Anyone can go onto their website and take these digital literacy assessments, things like how do you create an email? Do you know how to turn on a computer? Which might sound pretty basic to, I mean, we're on a call right now that's a, you know, a video call. And so it might seem very basic to you all. However, I know that there's a lot of people who may not have those skills. And so this was, if you're told that, oh, now you don't get to see your doctor in person, you have to get on your phone, you have to get on a computer or a tablet and use a browser and click this app and do these things. It's very daunting to some people. And so we saw that to fill this digital literacy gap, North Star was a great way to do that. And so through another source of funding, we were actually able to purchase licenses for many of our public libraries here in Western New York so that they can test it out for 6 months. They not only get the assessments and get all of the evaluation and statistics on the assessments, but they also, North Star has curricula that are designed for adult learners. They have online modules that take the learner through any areas of difficulty that they may have. Doesn't matter what it is. And so it's a really, really great tool. They actually just released a telehealth assessment that familiarizes the user with what's a good camera angle to take, what are certain icons, and what would you click on if you wanted to create or ask for an appointment with your provider, and how do you log in, how do you reset your password, things again that may seem relatively basic, but for someone who's unfamiliar with that digital skill, it's a great, great tool. So we are very, very glad to have partnered with them and really enjoy the work that they put into their project. They're a great group of people to work with. So on that note, I do want to leave time for questions, and please feel free to reach out to Heidi and I via email. We could talk about this for much longer if you wanted to hear more about it, but it's a really, really interesting project that was started, and we feel like it's just blossomed and we've grown a lot and learned a lot from other people through this whole process.
Thank you so much, Heidi and Olivia. This was really exciting. I think it's a very unique topic that our partners haven't really explored yet, but I think that in the future we're going to see a lot more innovative telehealth pilot programs like this. And I commend you both for taking this on, you know, on your end, being sort of like the first in New York to do something like this in the libraries. So I'm really excited to share this with our North Country partners and, you know, anyone else around New York that may be on the call today. And really, I believe it's just the beginning. So, you know, I thank you both. And there was a question that came in. It says, do you think that there are any opportunities? Oh, 1 second. I had an article open about the a new program in Maine. Actually, the Maine library system statewide is piloting a telehealth program as well, and I had that open to send the link, but an ad just popped up. I apologize about that. Back to the question. Do you think that there are any opportunities for other types of virtual care within libraries for patients that struggle with broadband or device access, such as remote patient monitoring?
Olivia, do you want to, since you're the health services expert? I mean, I know some of our libraries are purchasing equipment,
oximeters and blood pressure cuffs. Yeah, that was something that we had looked into originally. And given the pandemic, we were a little hesitant to offer some of those things because there's also the cleaning aspect that needs to take place. So that would be one additional task to be done to make sure that everything is sanitized and cleaned properly. But yeah, I'm sure that there are other opportunities for virtual care within libraries. It's kind of one of those things of, well, go in and try it. I mean, one thing that we saw people using the space for outside of health related things was a job interview. A lot of court cases are still being held virtually, and so people would come in and have a court case, like they go and meet with their lawyer and have that privacy of the space and the secure broadband connection, and be able to rely on a device that's being cared for and is up to date with all of the updates that need to be done on laptops and things like that. So I feel like there's opportunities in that realm as well. But I bet you could do remote patient monitoring. I'm not sure why you wouldn't be able to, but that's not something that we looked into. That would be something that we could ask at the next telehealth working group meeting. Actually, it would be interesting to see if someone has come up with that. I know that people talked about doing blood pressure monitoring at the previous meeting. But outside of that, I don't think I've heard of others that are doing anything along those lines.
A lot of people have said that they could see where for mental health counseling, like counseling visits, that this could be a really important thing. Where people maybe, there could be people who aren't comfortable doing that at home or at a clinic, but if they're in the privacy, in a private space in the library, that it might be better, more comfortable for them.
And I will say one other thing that I forgot to mention, the Senior Action Council actually was another place that had a lot of, they had a listing on their website of different libraries who were offering their Wi-Fi, or said that they had a room that people could use for telehealth appointments. And that was, I think it was heavily used in central New York. But I know that they had listings for many other places as well. And so it was neat to see that there were many other libraries who were wanting to join the initiative of making their space accessible and their Wi-Fi accessible to anyone who needed it during the pandemic.
Thank you. Yes, I totally agree. I think that the opportunities really are endless with partnerships with libraries and our healthcare partners. And it's something that, maybe wasn't considered previously, but since the pandemic, we've heard of some healthcare partners utilizing library parking lots and school parking lots to access their broadband connection for telehealth visits. Libraries are a trusted resource in communities, so I could definitely see community members turning to libraries and once they know that these services are offered. So again, this is just the beginning pilot. And I think you guys have a lot of great lessons learned, and I love that you really articulated the challenges that you faced, because it's really how we move forward, and I think it is super helpful for our partners to hear. I'm looking in the chat one more time. I don't see anything, and I know that sometimes participants will message the presenter or privately. So if you could check on your end quickly, just to see if anything came through.
Yeah, here. I had one that asked about, do you have a calendar to reserve time for patient appointments? And the scheduling aspect of it was something that we left up to each library because, again, we wanted the libraries to really own this as their own. And we think that part of that is letting them make some of the decisions that will work best for them and their staff. And so on down at the Prendergast Library, where they had the social work intern for 15 hours a week, they purposely scheduled those telehealth appointment times to be while she was physically on site, obviously, because she needed to be there to help with anyone who needed to use this space. And they had a phone number and an email address that people could sign up for a slot. All they needed to do was just reach out to her. I know at Delaware, the Delaware libraries, they had a beautiful form that you filled out that had, and I think you can actually, with the link that we provided on that slide, you can go and pretend that you're scheduling an appointment, but you'll see like it says which branch are you going to be at, what time do you want to come, and it reminds you like, oh, make sure that you buffer in maybe 15 minutes or something like that, because your provider isn't always going to be there right at 10 o'clock. And so make sure that you buffer not only for that, but for any technical issues that you might have. And so they kind of walk you through the process of scheduling that and signing up for a slot at the library. So they did a really good job of that. And I know that for Diane Connery, it was, I think they had pockets of time that different providers basically just they claimed them. So from 10 to noon, it was this provider, and that provider would then schedule whoever they wanted in that time slot. And that's what we tried to do with some of the community organizations, was say, oh, this mental health organization or this counseling group can have the telehealth pod from 1 to 3 every Wednesday or something like that. But obviously there's many different types of ways to schedule things, and a calendar would be one of them, and just having people sign up on their own would be a possibility. So yeah, lots of options.
Thank you so much. And I did get a question, how can we access the slides? I will send these out with the meeting recording and all of the updates. We don't have time, we're actually at the top of the hour to go through them, but when I send these out, be sure to take a look at the upcoming events. There's quite a few great webinars coming up from the Center for Connected Health Policy. Our ARE Gen program, in collaboration with our telehealth program, is hosting a webinar in June. That's really exciting, about advancing population health with telehealth. And we do have our information for our North Country Leadership Summit for the 2022 conference. It's being held September 19th to the 23rd. I have the link to our website. Call for presenters is now open, sponsorship, and our Telehealth Innovator Award nominee form. So definitely be sure to take a look at the notes that I send out, which has quite a bit more information to share with you all. I want to thank Olivia and Heidi once again for this great presentation. I'm super insightful, and I think it's such a great opportunity for our healthcare partners to hear about. And their information will be included as well in those notes if you want to reach out or have any questions. So with that, I will close it out for the May Telehealth Learning Collaborative, and we will see you in July. I'll have that date within the notes as well for you all. Thank you all.